Pandemic fears increase as towns lock down and 90% of deaths from a disease epidemic increase. As authorities worry about a potential pandemic, the number of deaths from an ongoing Ebola epidemic has increased by 63% in the past week. 48 confirmed cases of Ebola have been reported in the Democratic Republic of the Congo (DRC), according to a statement released by the World Health Organization on Thursday. Although there are fewer deaths than there were last week, 68. This is because of a spike in deaths, which increased from 19 on September 15th to 31 on September 18th, including at least for healthcare professionals. Tedros Adhanom Ghebreyesus, the head of the World Health Organization, stated on Thursday that 2 weeks have passed since the DRC government announced an Ebola outbreak. There have been 31 fatalities and 48 verified and probable cases reported thus far. 2 patients, nevertheless, have already recovered and been released. The WHO has supplied 14 tons of medical supplies, and another 16 are receiving treatment. The sobering report coincides with vaccination campaigns for frontline healthcare workers and those exposed to the Ebola virus in the DRC's Kasai province. Bulab, a current Ebola hotspot in the Kasai province, has received 400 doses of the FDA-approved Ervebo vaccine, which is only offered during outbreaks. The remaining 1,600 doses will be delivered in the next several days. No Ebola cases related to this outbreak have been reported in the United States or outside of the DRC, according to the CDC, which stated on Thursday that the risk of the disease spreading to the U.S. is considered low at this time. The DRC has had Ebola since 1976. This is the 16th outbreak nationwide and the 7th in Kasai province. In eastern Congo, outbreaks in 2018 and 2020 each claimed over 1,000 lives. Over 28,600 cases were documented during the greatest Ebola outbreak, which took place in West Africa between 2014 and 2016. Bulab is part of the Mweka territory, which is administered by François Mingambanjol, who told Reuters earlier this month that it's a crisis and cases are multiplying. Contact with an infected person's blood or bodily fluids, contaminated objects, or infected animals like bats or primates can all spread Ebola. Fever, headache, weakness and soreness in the muscles, vomiting, diarrhea, abdominal pain, and unexplained bleeding or bruises are some of the symptoms. If left untreated, Ebola can cause severe illness and have a 90% fatality rate. The Zaire ebolavirus species, which kills 36 to 90% of patients, is the cause of the present outbreak. It is believed to spread from animal reservoirs, most likely bats, to humans and is the most prevalent virulent ebolavirus species. To stop the spread, residents in some places have been kept in confinement to stop people from entering or leaving the Kasai region. Local authorities have also set up a number of checkpoints along the border. Ibanga and Inmeza Bar, the 2 FDA-approved therapies for Ebola at the moment. According to the WHO, a pregnant lady who visited Bulab General Reference Hospital on August 20th with a high fever, bloody stool, heavy bleeding, and weakness was the first confirmed case in the current outbreak in the DRC. On September 4th, tests revealed that she had Ebola, and she passed away 5 days later from organ failure. Another outbreak was reported earlier this year in Uganda, resulting in 4 fatalities, 12 confirmed cases, and 2 suspected cases. In April, the outbreak was deemed to be over. The Sudan virus, a rare virus that produces a severe variant of Ebola hemorrhagic fever, was the source of the outbreak, in addition to the usual symptoms of Ebola. It also results in organ failure, death, and bleeding from the eyes, nose, gums, and other body parts.